Greetings to all. I'm Gayatri, working as an assistant professor, the Department of Psychology at Dr. S.N.S. Rajalakshmi College of Arts and Science. Today, my case study is identifying maladaptive thought and beliefs. Objective of this study to understand the role of maladaptive thought and belief in brief CBT. CBT means cognitive behavior therapy. To learn methods for educating the patients about maladaptive thought and beliefs. The cognitive behavioral model suggests that three layers of cognitive dysfunction existing in individuals struggling with social or psychological problems. We have a three core behavioral model: automatic thought, intermediate thought, core belief. An automatic thought is a brief stream of thought about ourselves and others. Automatic thought largely apply to specific situation or an event and our quickly throughout the days as we apprise ourselves, our environment, and our future. We are often unaware of the thought, but are very familiar with the emotions that they create within us. Maladaptive automatic thoughts are distorted, reflecting of a situation which are often accepted as true. Automatic thoughts are the real-time manifestations of dysfunctions belief about oneself, the world, and the future that are triggered by situations or exaggerated by the psychiatric states such as anxiety or depression. Intermediate beliefs or attitude or rules that a person follows in his or her life that typically apply across the situation, not situation specific as with automatic thought. Intermediate beliefs can often be stated as conditional rules. If X and then Y. For example, if I am thin, then I will be loved by others. Individuals create these assumptions by categorizing the information they receive from the world around them. These rules guide thought and subsequently influence behaviors. Dysfunctional core beliefs drive dysfunctional rules and automatic thoughts. For example, the belief I'm unlovable may be driving the conditional rule. If I am thin, then I will be loved by others, which may drive obsessive thinking about one's appearances, excessive exercises, or disordered eating habits. This is all will be included. Core beliefs are often formed in childhood and solidated over time as a result of one's perception of experiences. Because individuals with psychological disorders tend to store information consistent with negative belief but ignore evidence that contradicts them. Core beliefs tend to be rigid and pervasive, although automatic thought are often tied to a specific situation trigger. Intermediate and core beliefs are more global and cut across the domains. Beck suggested that individuals tend to have core beliefs and individuals either interpersonal or achievement issues. When indicates and contraindicates. Identifying maladaptive automatic thought is the first step in the cognitive component of therapy. The focus of interventions of brief cognitive behavior therapy is the dysfunction automatic thought. Patients must master identifying and challenging thought to be able to grasp and the concept and the techniques of challenging beliefs. Because of the interrelated nature of the thought of beliefs, our intervention targeting automatic thoughts may also changing underlying beliefs. Therefore, beliefs cognitive behavior therapy can result in belief modification even if the target of treatment was automatic thought. Because patients progress through treatment at a different rates, you may be able to identify and challenge some beliefs late in a brief therapy sessions 5 to 8 for some patients. For other patients, work will be limited to automatic thought because skills building to alleviate symptoms and prevent relapse in a central focus of cognitive behavior therapy. Masters of skills is a paramount. Focus on building a skill set with the patients that he or she can generalize to different situation, thought, or beliefs. It is less important to identify and modify deep-seated childhood beliefs. For most patients in brief cognitive behavior therapy, this will not be necessary for symptom reduction. However, some patients may benefited from this work. Thought recording. We have a six options to thought recording and then we can calculate the mood now. Situation based thought recording, automatic thought, emotions and mood, evidence support and thought, evidence that doesn't support thought, and alternative thought. We can collect information from the client on during a rapport session. Then helpful questions. We have a three types of helpful questions: situational, feeling, and thought. Then we observe patients' discussion, especially cognitive distortions are all or nothing thinking, catastrophe, disqualifying or discounting the positive, emotional reasoning, labeling, magnifications or minimization, mental filter or tunnel vision, mind reading, overgeneralization, personalization, should and must statement. Thank you for watching.